what our shitty ass healthcare has come to. Where my patients need medicine and supplies and their insurance won't cover it, and here I am spending my own money because my patient needs it, and he doesn't have any money and he can't work. And the insurance won't even cover what he needs. And I'm sad and I'm sick and tired of it.
The U.S. healthcare system has about a month before it breaks. ACA premiums are projected to jump up 26%, and people can't afford it. So when people can't afford insurance, they go without it. They split pills, they skip treatments, they don't go to the doctor until they're at death's door. And then they go to the emergency room, which is literally the most expensive type of care that's available. Hospitals still have to treat them, costs surge, bills pile up, and the system snaps. And there's absolutely no warning, no safety net, and no way around it.
You ever wonder why the United States, the wealthiest country on earth, does not have universal health care? I think I figured it out. It's not because we can't afford it, it's because the people who run the economy can't afford for it to exist. So let's start with some numbers. Right now, the US total stock market is roughly $63 trillion in value. Of that $63 trillion in value, roughly 15% of that is a healthcare company of some sort, whether that be a hospital, a pharmaceutical company, or a private insurer. Which means our entire medical infrastructure is built on profit, and that 15% amounts to somewhere around $9 trillion of our stock market today. And these companies don't just exist, they anchor pension funds, 401ks, index funds, and state portfolios. So if you suddenly flip to universal coverage, removing the need for insurance would turn that $9 trillion around, and that would be an economic collapse just on that single part. But wait, there is more. And it's not just CEOs who would lose money, it's retirement funds, state pensions, university endowments, and public sector investing. So think about it like this. The American economy isn't just influenced by healthcare, it's partially dependent on it and it making money. So healthcare is treated like every other company. So like Microsoft, Nvidia, Apple, all those companies who hold roughly 40% of the stock market's value. Wall Street doesn't look at healthcare as a need. It looks at it as an asset that makes money. It's just an asset class to them. So if you were to reform healthcare like that, it would literally dismantle one of the biggest revenue machines on planet Earth. So universal healthcare would lower premiums for citizens, but it would also lower the revenue for the shareholders. And that's why giants in the healthcare, insurance, and pharmaceutical industries spend millions of dollars lobbying every year. And it's not because they want to protect medicine, it's because they want to protect their market. They want to protect their investments. So universal healthcare will never happen, not because it's impossible, but because it's too profitable to break the current system that we have. If you suddenly made healthcare a public good instead of a private business, you'd wipe out a major core of the American economy. Universal healthcare would save a lot of lives, but it would also wipe out trillions in shareholder dollars, which is what this country holds sacred. So until 15% of the economy stops depending on people getting sick, healthcare will not be a right in this country until we fix that system. And the truth is that nobody on Wall Street wants you to hear this.
Americans don't even get affordable health care right now. What the fuck makes you think immigrants do? They're not trying to take away health care for immigrants. They're trying to take away health care for you.
Want to see what happens when you find out the average ambulance bill is $1,200 without insurance, $600 with? He's off, ladies and gentlemen. He is refusing an ambulance ride because of the cost. The problem in America is that our medical costs are so high that without insurance or minimal insurance, you can go broke paying your bills. This is a gentleman who had a shark attached to his arm, and he's refusing medical care because he's worried about the cost. This is a big problem. People are not getting the care they need because they're worried about the cost. And why are things so expensive? Well, one of the main reasons is the ongoing fight between insurance companies and the hospitals. Hospitals will often decide on the price of things, and insurance companies only want to pay a small percentage of it. So let's say a hospital says, we're going to charge $1 for Tylenol. Well, the insurance company may only want to pay 20 cents. The hospital says, well, we need to make more of a profit to keep our business running. So then they charge $2 for a Tylenol, And again, the insurance company is like, well, maybe we're only going to pay 40 cents. And before you know it, after this back and forth, hospitals have raised the price of one Tylenol to $500. And then you come along with minimal insurance or no insurance and show up at the hospital, and they say that'll be $500 for that Tylenol. And that's the problem. It's the ongoing fight between insurance companies and the hospital, and unfortunately patients are getting stuck in between, and it just has to change.
Let me ask you one question. How can the richest country on earth have 1 million of people who can't afford to see a doctor? Welcome back to Likas Tech. Today we are talking about Americans' healthcare crisis, and it was done, you think.
Holy crap. So this past year, we were paying, I thought already, an obscene amount of money, like $700 some dollars. And the plan is $1,259 a month.
We just got our benefits for next year. What I'm currently paying $240 every 2 weeks for is going up to $709 every 2 weeks. How can I possibly survive paying $1,500 just in medical coverage?
Mine went up $230 a month. I don't think I could pay that. I might be having to go without health insurance.
I just logged in to our health insurance to see what, if we stay on the same plan, what our premium is going to be for 2026. $1,208.91 a month. I don't know if we can keep our heads above water next year.
I found out today from the marketplace that instead of paying $650 a month for health insurance for my son and me, I'm now going to be paying, with my current plan, $1,151 and some cents per month for my monthly premium. This is why Democrats haven't signed the bill. This is why they're refusing to sign, because they knew that people like me were going to see our health insurance premiums double without the subsidies, the premium tax credits.
If you haven't seen this all over your For You page, you're probably about to, because healthcare is going to get a lot more expensive.
What I'm currently paying $240 every 2 weeks for is going up to $709 every 2 weeks.
People are noticing how much their premiums are going up, and they're not happy.
Last year, for me, it would have been $100 to $120 a month. I'm looking at the health premiums for this next open enrollment. $400. Just for me, no spouse, no kids.
So why are premiums going up? For anyone who buys a healthcare plan off the marketplace, there's been this policy to cap your premium based on how much money you make. It kept insurance premiums below 8.5% of your annual income at most. So people making under about $23,000 paid near zero for insurance premiums. But that policy is going away.
There's no health care for us. There's no doctor, there's no dentist, there's no gyno. Oh my God, I'm about to cry.
It's expiring at the end of 2025, and I don't buy my insurance from the marketplace. I honestly don't have great health insurance, but if I did, my premium would be going up around $270 thanks to the GOP.
Right now we're paying around $950. We will be now looking at a little bit over $1,300 a month for two people to have access to health insurance.
Here's the politics of the situation. The Affordable Care Act was amended in 2021 with the passage of the American Rescue Plan. This was done in order to make health insurance more affordable. The program is called the ACA Premium Tax Credit. If you bought a plan on the marketplace in the last 4 years, you've benefited from this program. It going away might mean your premium going up by hundreds of dollars. For example, if you earn $31,300 a year, your premium used to be capped at 2% of your annual income and the rest was subsidized. Now, as this program expires, that bracket is set to pay $250 to $1,205 a month depending on what state you live in. Democrats are fighting to keep this tax credit that lowers monthly premiums in place, but Republicans are refusing to play ball. They would rather let the government shut down than do their job and come up with a plan to make healthcare affordable in America. If you don't like this one, come up with something else. And it makes sense to make it affordable, right? Because people will pay an endless amount of money to stay alive, probably. So the government stepping in and regulating this industry just makes sense policy-wise. On top of all of this, because we live in America, health insurers are raising premiums by 18%. Because if healthcare prices are going up, they might as well make even more money.
Obama made you buy health insurance, and Biden made you pay less, but only temporarily. And now both parties are letting your premium skyrocket in 2025. And it's not by accident, it's a bribe. Biden's discounts expire in 2025, and your bill goes up by 200 to 300%. Right now, if your premium is $600 a month, you pay $400 a month. And the government sends $200 straight to the insurance companies. That's $24 billion a year in free money to big insurance. But in 2025, those discounts disappear, and your bill goes back to $600 or higher. Why? Because Democrats let it happen. They know, and they don't care. They expanded these subsidies in 2021 temporarily, not to help you, to buy votes in 2022 and 2024. Now the election is over, and your bill goes up. But their donors, they're still getting paid. Here's the real thing that should piss you off. This isn't about health care. It's a cash pipeline to insurance companies. They lobby for subsidies. They donate to keep them coming, and when the subsidies expire, they blame the other side while raking in billions. Trump didn't create this. Obama did, and Biden extended it, but only until after the election. And now they're gridlocked because the real election is over. The real campaign, insurance companies versus you. They win and you lose. They're not fighting for you. The Democrats are fighting for their next campaign donation check from United Healthcare, Pfizer, and Blue Cross. They know what's coming. They know your premiums are about to explode if they haven't already, and they know that you'll be begging for relief this year. And they know that you'll blame the other party while they cash their checks. They shut the government down over $6 billion for Ukraine, but $24 billion a year for insurance companies? Not a peep. Because that money isn't for you, it's for them. You're the hostage, and they're the kidnappers. When your bill doubles in 2025, remember they knew, they let it happen, and they'll do it again. Because you keep falling for it. Democrats or Republicans, neither side work for you. So stop voting for either side and arguing amongst yourselves like they do. Share this if you're sick of it.
Hospital bill in America. Hospital bill in America is a scam. In fact, I would say it's a scam because I don't know what you guys are fixing. I recently had a meniscus tear. You guys charged me $81,000. Where will I see money? Where will I see money? Thank God that I have insurance. So I feel bad for people that don't have insurance. In fact, in this country, if you are sick and you don't have insurance, don't go to the hospital. Because it's better for you to just stay in your house and survive your illness or whatever. How can you charge me $81,000? Are you guys removing my kidney and putting a new one? Are you giving me a liver transplant? I don't understand. Are you doing a brain surgery? You guys just went there and just screw something in my knee, a meniscus tear, and you guys charge me $81,000. In fact, I have to write this to me because I'm angry. Just imagine I don't have insurance. Where will go see $81,000? Let me read for you. They charge me $74,000. Let me tell you what they charge me for. Supplies and devices, $43,000. Lab services, $176,000. Surgical procedure, $21,600. Anesthesia, now where they will make you sleep, $6,712. Pharmacy, the medication they gave me, $179. Recovery, my own recovery. Oh, you guys charge me for my own recovery. Recovery, $2,301. That's one. They now charge me one again. They say it's $4,200 for bones, joint, and muscle. That one is one. Oh. They now charge me another one again. Bones, joint, and muscle services, $2,967. What's in be all this? America. In total, is now $81,819. Imagine I don't have insurance. Where will I even see money? I remember when I don't have insurance, if I don't even go to the hospital, what's my business there? This country, you cannot be sick. And this is annoying. Like, what are you guys? Is it mortgage? It's $1,000. Is it mortgage? Am I buying a new house or a Lamborghini that you guys want to come and charge me? It's $1,000. Thank God I have insurance. Just imagine I don't have insurance. Well, how will I pay this money? Nah, America, you guys are doing too much. You guys are doing too much.
The cost of healthcare in America has ballooned over the last 20, 30 years, and it's not because doctors cost more to the system. Healthcare has skyrocketed because for every doctor, you need like 10 to 15 administrators. It's literally a disaster.
Is there a solution?
No.
I mean, no, there's not.
Well, some people will say universal healthcare is the solution.
Yeah.
There's no one-size-fits-all answer because some people will say, well, universal healthcare isn't free healthcare. It's still paid by somebody. It's paid by us, the taxpayers. And if we're being honest, whatever the government does usually isn't the most effective or efficient way of doing things.
Right now, in America, people are choosing between rent or medicine, food or hospital bill, survival or death. Simple. Ambulance ride can cost you over $1,000. A short emergency visit can reach up to $5,000. Even $10,000. Or do something about your checkup. The craziest part, most Americans have health insurance, but still can't afford to use it. Deductibles are sky high, perceptions are expensive, a life-saving treatment can leave family bankrupt for a decade. You have people working full-time job who are not raising, who are avoiding check-up because they fear of the bill more than the illness. Why US? What's happened? You are the richest country in the world, but why your people are surviving, are struggling? Teachers, nurses, delivery drivers, normal people, regular, launching Go Fund Me campaign just to pay for a cancer treatment or surgery. What you don't know, in Africa, cancer treatment is free. Imagine being sick and then being punished financially just trying to stay alive in the United States. So, meanwhile, other countries provide universal affordable health care, but in USA, the cost of breaking army can be price of used for a car. So, every year, Americans skip over 100 million medical appointments because of the cost. The system doesn't help people. That is not a system, that is a crisis.
Thanks very much for joining me. Let's be clear. Our healthcare system today is incredibly broken, dysfunctional, and cruel. 85 million Americans are uninsured or underinsured. We pay the highest prices in the world by far for healthcare. 1 out of 4 Americans can't afford the outrageous prices of prescription drugs. We don't have enough doctors, nurses, dentists, mental health counselors, or other healthcare professionals. Our life expectancy is already far lower than other major countries. Yes, our healthcare system today is already broken. And in my view, in order to remedy that crisis, we have got to do what every other major country on earth does. Not a radical idea, and that is to guarantee healthcare to all people as a human right. But what I have to tell you is that in the midst of all of this, the dysfunctionality of the current healthcare system, Donald Trump and his friends are making a horrific situation even worse. In fact, they are pushing our healthcare system over the edge to the verge of collapse. Now, you think your health insurance costs are high right now? You think you're already paying the highest prices in the world for healthcare? Well, guess what? Within the next couple of weeks, millions of Americans are going to get a letter from their insurance companies telling them that their insurance premiums will double. Let me repeat. As a result of Trump's big, beautiful bill and massive cuts to the Affordable Care Act, your health insurance premiums for 24 million Americans are going to double. And maybe even worse, could get worse, as part of that big, beautiful bill. 15 million Americans will be thrown off of Medicaid and the Affordable Care Act. Studies from Yale University and the University of Pennsylvania suggest that when you throw 15 million low-income and working-class people off of the health care they have, some 50,000 people will die unnecessarily every single year. It's not hard to figure out why. If you're low income, you're working class, you're sick, you don't have any health insurance, you can't go to a doctor, you can't get into a hospital, you know what, you're gonna die. 50,000 people unnecessarily every single year. But it's not just insurance premiums or getting thrown off the health care that you have. As part of these awful cuts, nursing homes in America are gonna be decimated. My office has studied some of this. The nursing home situation in America today is a disaster. They're understaffed. And the way we treat the elderly and disabled who are in nursing homes is something we should be ashamed about. But guess what? When 2 out of 3 people in nursing homes are dependent on Medicaid, that situation is going to become much worse. Rural hospitals are going to be hard hit. Republicans like to talk about investing $50 billion into rural health care. But what they somehow forgot to tell you is that their cuts in the bill are $150 billion. In other words, they put $50 billion in after taking $150 billion out. That's a loss of $100 billion for rural health care. Further, we're talking about community health centers. 32 million Americans, all walks of life, get their health care, primary health care, dental care, mental health counseling, low-cost prescription drugs from community health centers. They are going to be decimated as a result of these cuts. So my friends, this is, in my view, what this government shutdown is all about. Republicans want what they call a clean CR. And what that means, for the first time ever, what they want to do is push forward a bill and get it passed without any Democratic input. Now, in the Senate, the rules are clear. They need 60 votes. And what that means always is there has to be bipartisanship. You want 60 votes, you got to have both parties coming together. Republicans are not doing that. They're not negotiating. They're simply saying, take it or leave it, my way or the highway. Well, many of us in Congress are not going to take it. So that is what this whole government shutdown is about. Now, you may not hear much of it from the media, you may not hear it from most Democrats or Republicans, but that is the simple truth. So let me be as honest as I can be. And that is, I do not intend to vote for legislation that will allow 50,000 Americans to die unnecessarily every single year. Ain't gonna get my vote. So let me conclude by asking for your help. I can give all the speeches I want. Other members of Congress can give great speeches. They do fine. But what's more important is that my colleagues hear from you. So right now I am asking people all over this country, including you, you, to share your story. I am the ranking member of the Senate Health, Education, Labor, and Pensions Committee. And I want to hear from you as to what a doubling of your health care premiums will mean for you and your family. I want to hear what it will mean if you are one of the 15 million people being thrown off the health care you have because of the massive cuts to Medicaid and the Affordable Care Act. I want to hear from you as to what it will mean if you have a family member in a nursing home and that nursing home has got to cut back on staffing because they don't have the funds or maybe even shut down. What does it mean if you're currently visiting a rural health center, you live near a rural hospital? The time is now for the American people to speak up. So I would very much appreciate hearing from you. Thank you very much.
So we have more troubling news because of Trump's handling of the economy and the healthcare crisis. United Healthcare just announced that they are removing 1 million senior citizens, 1 million from the United Healthcare Medicare Advantage plan. 1 million. Why are they doing this? Because their profits are tanking. Why are their profits tanking? Because medical care costs are increasing. Why are they increasing? Because of the what? Upwards of $1 trillion in cuts to Medicaid and Medicare. And because there are so many more people now uninsured, they can't afford these premiums. And no, they're not illegals. They're American citizens. But all of these people who are increasingly uninsured still go to the hospital, still need emergency care. So that gets passed on in the form of higher medical costs to those that are insured. Now, the 1 million senior citizens on the Medicare Advantage program is considered a low-hanging fruit for United Healthcare because they're specifically targeting senior citizens on low income. They pay the lowest in premiums, but they utilize a lot of medical care, so the return on investment is getting poorer and poorer for this for-profit healthcare company. And those million senior citizens, a lot of them are located in red states. This affects you too, Trump voters. Seniors who voted for Trump, this affects you too. What's most troubling is that economists are saying this, what United Healthcare is doing is a leading indicator of what's next, what's going to be done by other for-profit insurance companies. And once they cut senior citizens off of these plans, you better believe it, they're going to go after other programs for insuring people who are not senior citizens. Great job, Trump.
Think universal health care is a modern, radical idea? Well, the US almost had it in 1945. No insurance companies, no surprise bills, just health care for all. But then, the American Medical Association, Big Pharma, and the far right stepped in and dismantled the plan. Post-World War II, Senator Wagner and Murray, along with Representative Dingell, introduced a bill for national health insurance. It was simple, publicly funded, government-backed healthcare for all. The bill was modeled after President Truman's vision for comprehensive healthcare reform, a national prepaid system funded by a 4% payroll tax that would cover all working people, their dependents, and other needy people. Truman called for the insurance fund to cover medical care, nursing, laboratory services, and even dental care. It had the backing of the president, labor unions, and the public. Democrats controlled the House, Senate, and the presidency. So we were this close to Medicare for all. Then who killed the plan? The American Medical Association. The AMA branded the bill as socialized medicine and un-American, then launched an aggressive and decades-long campaign to kill it. They tasked tens of thousands of physicians with handing out pamphlets instructing them to warn their patients of the dangers of socialized medicine, and then recruited thousands of corporations to spend $19 million on a coordinated newspaper ad campaign. The goal? Kill the National Health Insurance Act and enroll millions more people in the voluntary private insurance plans. So they didn't just attack the bill, they went after Truman himself, painting him as a socialist sympathizer, the worst thing you could be. And it worked. In 1949, a Gallup poll showed that 59% of Americans supported national health insurance. But by the time the AMA was done, that number had dropped to 24%. They turned public opinion, torpedoed the legislation, and helped drive Truman and his plan out of power. But it didn't stop there. For over 100 years, the AMA has fought nearly every major effort towards universal or single-payer health care. From opposing Medicare in the 1960s to lobbying against the public option in the 2000s. Today, they remain one of the top 10 lobbyists working alongside Big Pharma, hospital associations, and the private insurers to keep healthcare in corporate hands. Today, the US remains one of the few industrialized nations without universal healthcare. Keeping America's patchwork system of private insurers was a deliberate strategy to maintain corporate profits, not a necessity. About 25 million Americans are uninsured. Medications are priced like luxury items. For instance, Viberzi, used to treat IBS, can cost $1,100 per month, the same price as a new laptop. This isn't uncommon. Medical costs are the #1 cause of bankruptcy for American families. We didn't choose this system, it was chosen for us by people who profit from your suffering. Universal health care isn't some radical fantasy, it's an unfinished promise. We had the blueprint, we had the movement, we had the support. What we lacked was the power to beat back corporate America. So the fight for universal health care continues. Perhaps it's time to finish what was started in 1945.
Whether you live in America or you are watching from overseas, this affects all of us. No one should choose between staying alive or going broke. If you want me to cover more issues like this, hit like button, comment your thought and share this video. This is Lucas Tech. See you in the next one. I love you guys.